Okay, we are live. Um, my name is Sarah Hornsby, and this is the 25th video that I've done interviewing professionals for Mouth Breathing Awareness Month. So I started this mouth breathing awareness campaign as a way to basically increase people's awareness of mouth breathing and myofunctional symptoms. And I really see mouth breathing as this red flag symptom that can show us that there's other bigger stuff going on with people's health. So it's been my mission to interview all the amazing dentists and hygienists that I get to meet through my MyoMentor program. And so today I have Karyn Kasvin, and she is going to be showing her or sharing her story of her daughter who's 17 and kind of, how her daughter's symptoms led her to get into so much of this other stuff. So why don't you introduce yourself, Karyn? I know you're a hygienist, a myofunctional therapist, and you do a lot more too. So.
Yeah, my name's Karyn, and I've been a dental hygienist for 30 years. And I've been practicing with Clover Valley Wellness for, I guess it's been about 4 years that I've been in business. So, but I learned about myofunctional therapy in about 2012. And
Wow.
I actually didn't even relate a lot of this to my daughter initially, but as it comes to be, she has a lot of these issues. So yeah, I like to talk about my daughter because I really felt led to find the right treatment, and was kind of frustrated that I couldn't find the right treatment because I knew she needed more, but I was led in a good way, and I, definitely had a lot of successes. So,
well, I'm happy that you're sharing your story about her because she's a teenager, and all the other stories that have been shared throughout this have been parents speaking about their young kids or babies, and so I like that we have a different perspective with your daughter's story. So sorry to interrupt.
Yeah, well, I think I noticed problems starting about 3 years old. When she was getting a lot of cavities. I'm like, I'm a dental hygienist, she shouldn't be getting this many cavities. But then I realized that she was mouth breathing, because I knew that connection, mouth breathing and decay. And then, I breastfed for like 3 years, and we co-slept until she was at least 4. And at about 4, I noticed she stopped breathing at night. And I was counting. I'm counting, like, I don't know, 30 seconds or more. And I'm like, okay, there's something wrong here. So I took her to an ENT, and the ENT was like, okay, well, we can watch and wait. They didn't look at her adenoids. Her tonsils were big, but they, she might grow out of it. And I'm like, this is not good. She's not breathing. So I went and found another ENT that would remove them. And he did say, oh, her adenoids were huge. And the question I didn't ask was why? Why were they large? So come to find out later that she did have some dairy allergies. So
common.
And then and that did help her sleep breathing. So she did start breathing much better. And so then the next thing and she also had a bout of pneumonia, I think, between the cavities and the
adenoid
tonsil removal. Yeah. So, and then I noticed her teeth coming in, and they're coming in extremely crooked. And I didn't connect the relationship between an open mouth and improper facial growth, because we knew about tongue ties, we knew about mouth breathing, but we didn't have that connection with facial growth. So, so I went and took her to an orthodontist, and I'm like, I think she needs something more. There's something wrong with her growth here. I mean, I knew there was something wrong. So they did just general rapid palatal expansion, and she got a lot of headaches from that.
Really? Okay.
And she still had the open mouth breathing. And because I go back and I look at pictures of her, and I'm like, I see now all the times where she did have this sneaky little open mouth all the time, and then still open mouth breathing at night.
And this wasn't so much what you were noticing at the time. This is more like now knowing what you know today, reflecting back.
Exactly.
Because at the time, maybe you noticed it, maybe you didn't, but you weren't making decisions around that, right?
Yeah, I mean, I have pictures of her sleeping with her open mouth, and I don't know if I was taking pictures of her because her mouth was open. I don't think I was, but I look back and I'm like, her mouth is open. So
That's so crazy, right? Like
yeah, so
looking through a different lens.
I know. So she got the phase one, and that helped. All her teeth started falling out because her teeth were not coming out because they were too crowded. And then I think I was noticing she was still grinding at night too, grinding her teeth at night.
Okay.
You know, she had a lot of behavior. As I look back, I know we had trouble breastfeeding. I breastfed for 3 years, but you know, I was a new mom. I didn't know, you know, they weren't supposed to like breastfeed all night. She was like you know, she took a long time to breastfeed, and she used to throw up, you know, and she was crying a lot. I had to hold her all the time. You know, now I see all these symptoms, and then a lot of behavior issues when she was younger. And I just thought, you know, she's a very fun, loving, happy child, but she would break down emotionally a lot. And, you know, and so that was another red
that
flag.
can be such a sign of the poor sleep, because if you're not getting that restorative, regenerative, deep sleep because of breathing issues, then of course you're going to be like emotionally not able to cope, you know, and
right.
you know, it's harder. You're like at the you're just not so resilient, you know, when you're not sleeping. So
Exactly. But I didn't make those correlations at that time. And then I took an intro course. It wasn't an intro course. It was just like a continuing education course through our Dental Hygiene Society on myofunctional therapy with Joy Moeller. And I was like, this makes total sense. And it, you know, with my experience with Pilates and just movement of the body, I'm like, this makes perfect sense. I can do this. I need to do this. And I saw those connections. I didn't really relate it to my daughter yet because I'm like, well, she doesn't have a tongue thrust.
yeah.
You know?
Yeah.
And her mouth was closed more during the day at that time. But and then again, she had phase 2 orthodontics. Well, actually, at the time after I took that course, then I started assessing my friends and my family and coaching them, you know, to stop sucking their thumb and to do something. So I
through your nose, put your tongue up, all that kind of like, you know, stuff you can tell people. And yeah,
and I saw the impact that it was making. And then when Natasha turned 10, I'm like, okay, she has a gummy smile and there's something going on. She needs a little bit more. And I didn't know about, you know, functional orthodontics at that time. I didn't have access to that. So she just did regular phase 2 orthodontics. And then again, just recently, she ended up having phase 3, which was kind of to somewhat reverse the phase 2 and do some sagittal expansion forward.
Wow.
And because she was still kind of grinding her teeth. So, and then about age 14, I finally had connected with the orthotropic kind of orthodontist and said, can you do anything to help her? And he's like, well, you know, she has a tongue tie. And it was interesting that I didn't quite recognize that yet in her. And I think, you know, you see your children differently, but it was a posterior tongue tie and it was not as obvious. So she ended up having that revised at 15. And I think that made a great difference for her. And then in addition to this little bit of sagittal expansion, you know, she doesn't have shakes anymore. She's not grinding. I check her with the snore lab to make sure she's sleeping well. She's keeping her mouth closed all night.
Good.
So,
I'm curious, as she's going through all this stuff as a teenager and your mom, has she been pretty receptive and like open and like wanting to do all this? Or is it kind of like, mom, leave me alone. Like, why do I have to do all this?
No, she totally trusts me. And
good.
I think, you know, she sees the need herself. And throughout this time, even as an infant, she did some craniosacral therapy because she had a traumatic C-section birth. And even, you know, she's done some myofascial release.
So she has a really good, like, full body understanding. That's awesome.
Right. Yeah. And even now she's seeing an osteopath, and we're looking at the lip. We're not sure if we're going to do the lip, but you know, she's a beautiful girl. Her facial develop. I mean, she's gorgeous. But if I could have done something differently, I mean, I wish I would have recognized this when she was a baby, you know?
Yeah. Oh, for sure. And I mean, I think every parent wishes that they knew this earlier, and at least it wasn't 10 years beyond, or, at least she's not finding out as an adult by herself, So
Right. And
I
it's
think
never
there's
too
still,
late to make a big change
oh,
and,
for
you know,
sure.
yeah.
Yeah. No, I think that's really helpful for parents to hear. So, all her symptoms, it seems like, releasing the tongue tie, doing the therapy, doing the third phase of orthodontics, where they really kind of took things a little bit further forward versus just the original expansion. You definitely have seen changes and results, it sounds like.
Totally.
Yeah,
Totally. And
good.
that was really good. I knew this information on mouth breathing too, because when I turned 50 about 4 years ago, my mouth started opening when I was sleeping. And I noticed, my mouth is dry. So I started taping right away. And we know that that's kind of a lack of, lowering progesterone, lower
Yeah.
muscle tone. So I definitely
No, I'm
experienced
so
that.
glad that you're saying that. Yeah. It's something that's really common, as our hormone levels change, this is when a lot of sleep disorder breathing comes on, for women. And I think it's really common. I see it in my practice, and I don't know if you do, but, people just start to think, I'm breathing through my mouth at night. I don't remember ever doing that before. My mouth is dry, or I feel like I'm not sleeping as well. And the doctor says, oh, it's just menopause, and, or premenopause or whatever. But there could be more to it with the airway stuff that I don't know that, how much of it is strictly like hormones, and how much of it is the combination of the hormones changing the breathing or whatever. We know there's a big overlap with those changes and sleep issues starting. So,
Right. So I did get some sagittal expansion myself as well, and that
yeah.
helped. That helped my sleep definitely. And I used to clench my teeth, and that has gone away too. So
That's great. So you
Mhm.
guys have gone through a lot of this stuff together. What about tongue tie release? Did you ever have yours released, or were you tongue tied?
No, I seem to be fine. Yeah.
That's good. Yeah.
Mhm.
I know people always ask me too. I'm like, I seem fine. Sometimes I wish I could go through it just to see, what my patients go through, but I don't think it's necessary. So
Yeah. Well, it was good to go through it with my daughter, and I love sharing this information with people, and it's simple, it's complex. There's a lot of pieces to the puzzle, but it's simple aha moments that totally
yeah.
make sense. That people just need to hear once, and they're like, oh yeah, that totally makes sense. And these are
Yeah.
I want to give people the tools to help themselves is my kind of motto. And
I like that.
there's just building awareness in your body of how your body works, understanding how your body works, and then using these tools that we can give you, that we're always having to learn new tools in this profession. But
Yeah,
there's so much that people can do for themselves and their children just by being aware, observing your kids
for
and
sure.
yourself, and just
Exactly. Which is like why we're here, why we're doing this. Because if people can just hear, wow, mouth breathing is a problem, then at least they can start looking out for that little symptom. So,
Mhm.
and it seems little, but it's actually like we've been talking about. It's such an indicator of potential other problems today, in the past, or in the future. So, yeah. Well, why don't you give people your information on how they can get in touch with you if, they're looking for a myofunctional therapist. Actually, give some of the other information about what you do as well, because I know you've got kind of an array of things you're doing beyond myofunctional therapy. You're doing Buteyko Breathing. You tell us. And by the way, I should say you're in Rockland, California. So anyone in the
Yeah.
Sacramento area, that's who could potentially come see you. So
Yeah, and I see people online too.
cool.
I like a combination, but I can do both.
Awesome.
So yeah, I'm trained in the Buteyko breathing method. I'm also training with Rosalba Courtney. I did just it's like a constant process of learning. But
Yeah. Oh my gosh.
yeah, yeah, the breathing training I feel is the number one. You know, and so I utilize those techniques. And then I also integrate some of my knowledge with Pilates and the Franklin method, which is dynamic imagery. Again, understanding how the anatomy of your body works and how your body is functioning. And kids, even young kids, can understand these concepts. And then how your body is working, understanding that is going to help your body to work better. So teaching people those kind of techniques, integrating breathing into that, and posture training.
And it all pairs so well with this myofunctional stuff we're talking about. I mean, you can't really separate the body up into like these different compartments, although we all try to. Really, the tongue posture and the breathing goes with all the rest of the stuff that you're doing, no matter what. So yeah, I love what you're doing.
Thanks. Understanding the fascial connection too in your body. And yeah, I learned these techniques of self-myofascial release with the little balls. Ball rolling. I learned this when I was a professional dancer and doing Pilates, and it just changed the way I do things. And I didn't understand how it worked, but now, you know, there's so much more science behind all of this stuff. We're getting the evidence of why this stuff works, but we see it clinically being really
We're starting to get research to actually back up the things that we've known for a long time, but now we can say, oh, here's a paper that supports it, you know?
Exactly.
Well, thank you so much. So I'm just going to give your name a shout out. It's Clover Valley Wellness. You're in Rockland, California. And so if anybody wants to reach out to Karyn, please do. Karyn, I'll get your information, like your website, social media, all that stuff. I'll link it to the video. But any last shout outs or any words you want to say, or should we just wrap it up?
Well, I just want to thank you, Sarah, for getting the word out so well and for all that you do.
Thank you. That's awesome. Well, I appreciate that so much. And I'm really happy that you wanted to share your story and let me interview you. That's what I need. So, all right. Well, I'll let you get going. I'll talk to you later.
Thanks.
Bye.
Bye.